Welcome, everyone, to the Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I am joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I'm doing pretty good. How you doing?
I'm good. I have something exciting to talk about today that is a little bit different.
Nice.
So if anyone's interested in watching the video that goes along with this podcast or seeing the one slide that comes with it, you can find that on our YouTube channel at Jason Martin MD. We're also on Instagram at Beauty and the Surgeon Podcast.
Yeah, the YouTube channel's blown up.
It is.
Love the YouTube channel.
Well, people like watching us. Really more interesting to see than this.
All right.
Yeah.
Sometimes that's more entertaining than what we're saying.
It absolutely is. So our last podcast episode, we went over my experience at the Nutritional Therapy conference, which I went to, and it was kind of a long podcast. I'm sorry, but if you want a broad overview of 3 days of...
Now, there's some people out there that made it through the whole thing, and they're like, that was awesome. Right? There's like 75% of the people out there, they're like, oh my God.
Biofield, click. So,
Reiki, out.
If you listen to that podcast, thank you so much for listening. Yeah. This is, we're talking a little bit more about my experience at the Nutritional Therapy conference, but in a completely different way. So the title of this podcast, I let Sarah pick. Sarah's our producer's wife. She also does all of our awesome slides. I said, Sarah, this is what I'm going to talk about. Call it whatever you want. So she chose the name, and it's Where Nutrition and Medical Care Intersect. And it was a really cool experience. I was actually approached by someone at the NTA, the Nutritional Therapy Association, and asked if I would be willing to host a roundtable discussion about working with medical practices, like working with doctors. So initially, the title of my little presentation was supposed to be Working with Doctors, but they changed it to Integrating Your Practice. I took a little picture. There was my little table set up. But I thought it would be really fun to talk about the questions that these fellow nutritional therapy practitioners had with a doctor, because it just so happens I've got one here.
Are you talking about Nils or me?
I'm talking about you.
Okay.
The surgeon in Beauty and the Surgeon. One funny story from it, which, no, I'm a nerd.
But I have to say that every single person I talk to that doesn't really know us, oh, you're not the beauty, you're the beast.
And you're the surgeon.
Right. And I was like, no, I'm the surgeon. They're like, well, that doesn't make sense. I'm like,
yes, it does.
I'm not a beast.
You're the surgeon.
Okay.
So one woman at the table, we were kind of joking about that I work with a plastic surgeon. And I said, yeah, he's really good. I'm 70. And she literally just sat there and she was staring at me for a few minutes. She goes, you're really 70? I'm like, it is a joke, people.
That's like a go-to joke.
Yep.
That's low-hanging fruit. That's a low-hanging fruit.
Yeah. So
all right.
I got 3 tables, essentially. So they were each 20 minutes, and people would just come up and sit down. And
if you look on the slide, actually, if you look on our YouTube channel, our Beauty and the Surgeon mug is representing at the table. So that went around the world.
Yep, it did.
Did you decontaminate the mug?
Oh, yeah. Oh, my gosh. Well, so yeah.
Coronavirus?
I washed it a lot. Yeah. It's been washed many times since then, and no one else touched it.
Makes me
no
feel
one
better.
else touches me. So it was cool. So I didn't know. I mean, I had a roundtable. I'm talking about working with doctors. Come at me. Bring your questions on. And the one question that all 3 groups of people asked me was, how would they go about getting their foot in the door with a doctor?
So that's a tough question. So you think about nutritional therapy, which you and I both are big believers, and we feel that that's an integral part of health. You would assume that almost all doctors who treat patients with ailments would consider at least having associations with people that are nutritional experts.
Perhaps, yeah.
But it's not the case.
It's not, unfortunately. And, the one thing I really encouraged all of them was to really have the thought in mind that you're going to approach a lot of doctors, and you're going to get a lot of people who are not interested, and doctors you may just not click with. You don't want to get referrals from a doctor who you don't really jive with. That's not who you want as your referral source. But really reaching out to a lot of practitioners. I highly recommend reaching out to surgeons, because I think in general in medicine, surgeons are probably more interested in making sure that their patients are optimally healthy for surgery and recovering well. So if you can explain to them how you're going to help their patients be healthy and ready for surgery, recover fast.
Yeah, I think it's two-pronged. I think the surgeons or people that do procedures where you have to optimize the patient's health to get a good outcome and recovery, and also for people that are on the front lines, like internal medicine, family practitioners that deal with people with the chronic problems, where nutrition could make a big difference.
Yep, chronic lifestyle factor things that they just can't address.
One of the things that you work against with nutrition is that historically, and you're a nutritional therapy practitioner now. They used to be clinician, right?
Counselor.
Counselor. Hello, counselor.
Counselor. Yeah.
Anyways, so historically, in medicine at least, nutritionists have not had as much, maybe I'm speaking out of turn, so you can correct me, as much training as NTCs have or NTPs now. And they haven't maybe brought as much to the table. Nutritionists in healthcare just follow set guidelines.
That's registered dietitian.
Registered dietitian, sorry.
Mm-hmm. Have to follow the pyramid.
Yep. And doctors who are not really great with nutrition, but they're capable of reading things, you can just already see that some of these recommendations are archaic and they may not be as helpful to their patients. So what doctors then do is try to find little tricks they can with themselves, like don't eat cookies, blah, 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 that kind of thing, and in hopes that, cut out cookies. Trying to find little tricks as opposed to bringing people in that they don't think are value add. When you're in your situation, when you're a true expert that you've gone through, it's a long training to do it, then you need to make the physician know that you're bringing something to the table. And that's important for people listening to this, that you need to find out who is giving you nutritional counseling. A lot of people do it. People that are
health coaches,
wellness
things.
coaches.
Yes. Trainers at your gym.
Tons of trainers.
who have no business giving
experience.
Advice.
Yeah. And so they get into that for reasons that for financial gain, and most of the time it's not malicious. That, if you want to make someone change their body, 75% of that is what goes in your mouth. 25% is the workout part. So it's easier if you want to have a good change when you're a trainer, obviously,
Right. You need to talk to your patients about nutrition.
Yeah. But that's one of the things. That they're working against the current with physicians who historically have not had a lot of real value from that sector. Mm-hmm. And so you have to bring it to the table. You have to get over that hump or talking to that physician about their inherent bias that they have already.
Yep, absolutely. And I brought that up. I also, kind of, because, I've had the experience working with you for 12 years and just working in the healthcare field in general. You're just an old lady.
I need to get a new Amy.
You do need you need a younger Amy. Maybe trade it out for a new Amy, a bot Amy.
Yeah. I need a new Nils.
Nils can be aged forever. Just really.
It's a 20-year-old Amy. Hi, how you doing?
Right? She'll be super smart.
I scheduled you on TikTok.
Explaining to these NTPs that, doctors are kind of trained and they are bound by standards of care.
Yep.
In practice. So they're always going to want evidence-based practices, repeatable outcomes. Like these are things that are important to doctors for good reason. Like they're ethical. They want to follow a standard of care. So approaching them with like kind of woo-woo things, as Dr. Martin would say, is really not going to be effective. Like a great way to approach a physician.
And I'm the most tolerant because I have an immense amount of respect for this person sitting next to me who does this for a living. And when she comes to me with woo-woo stuff, I listen. Inside, I have a feeling that someone's scratching a chalkboard. And then I get over that. So, what I really appreciate what Amy does for me as a physician is she brings me real data. She sends me articles. She shows me the data. Mm-hmm. And like the last episode, which was in the weeds, but that's really important to me. I learned so much from that episode about nutrition, about the future. So I think that's what you have to bring to the table. It has to be a value add. Healthcare is about teamwork. It's about a team. It's about a medical team, and everyone has to play their part. And so if you want to be part of the healthcare team, you got to bring it to the table.
Right.
You have to be a value add for disease prevention, for disease treatment, and for wellness and health and longevity.
Right. And that's very much that point. That's why I would brought up to them, like making it clear that you can improve their outcomes and also that you have the time to spend that they don't. So you're saving them time and you're helping their patients. I'm like, those are really the key things. That's what's going to sell a doctor is if you can help their patients feel better, have better outcomes, and you're saving them time and effort and work. That's a huge bonus.
I think another way to put it for physicians who may be business oriented is say, you want to build loyalty, do it this way. Like I can help build loyalty with your patient base. If they see transformation, that's something they can do and empower themselves from a nutritional standpoint that doesn't involve taking medication or some treatment, that empowers the patient. They become better patients, more loyal, and they'll follow their instructions better. Mm-hmm. It's a better health outcome. That's been shown across the board. Why do you think we treat mental illness in people that have medical issues? They have better health outcomes because once you treat mental illness, they're more compliant. They're more willing to show up for their appointments and take their medications and stuff. It's the same thing with this. If you build loyalty with patients, it creates a better health outcome for sure.
Yeah, absolutely. And the other thing that I stress to them too is something we do have at our disposal, which is an amazing tool, is the NAQ, the Nutritional Assessment Questionnaire.
Which I got 100% on.
Right. I actually shared that story with all the tables. I'm like, well, the first time I gave it to my doctor, he picked 0 for everything and gave it back to me with a sticky note that said, "Tell me I'm the best." And they laughed.
And nothing wrong.
Right. Well, that's the problem with that, is that 0 is not always the right answer. And that's what I had to tell you. I'm like, 0 is not the right answer. Take it again.
It was a tricky test. It tricked me.
Right. The first few things 0 might be the right answer, but as you get farther down, 0s can be bad. So I'm like, take it again.
Yeah.
Read the questions. But you have data, and I have expressed to them how much doctors are data driven. I'm like, we have data, like we have the NAC, we have graphs and charts, and like we can follow people, have them take the NAC again. You can see improvement, and that improvement will translate into real improvements in their health. So having the doctor that might be on the fence take the NAC and discussing it with them, I feel like is really powerful as well.
Yeah.
And every time I've worked with a new doctor.
It's like if you're trying to sell someone a mattress, you have them lay down on it.
Yeah.
Feel it out.
But taking the NAC, as you know, there are questions on the NAC that cue you into what could be going on in somebody's health in ways that are different than just a nutrition questionnaire about what you're eating. Do you hear your heart at night on your pillow? Like, these are questions that doctors are going to understand where we're going with that. Like, what questions are attached to what systems and organs in the body, which I feel like that in and of itself is very powerful. It's so funny when I give the NAC to other doctors and then talk to them about it, like the things they pick up on or the things that they tell me about or think are funny and not maybe related to health always surprised me. Like, one doctor was really skeptical and still has only ever sent me patients to quote unquote lose weight and will actually call me and say, like, you help people lose weight, right? I'm like, yeah, I do more than that, but like, whatever. Give them my card. Was joking about like having foul smelling bowel movements and thought that was like, doesn't everybody, like, whose shit doesn't stink, and like, well, it's different. There's a difference there. And like, yes, I do care about that. So like, I am going to help your patients with their whole system functioning efficiently.
That doctor did not go through general surgery because we had to learn all the pathophysiology of foul smelling stool and, stool consistency. Like, half our questions were about the patient's poop.
Right. Well, there's actual charts that you can,
Who was the doctor with the poop emojis all over her website?
Oh, it wasn't. That was Tosca Reno.
Oh, okay.
Yeah, she's not a doctor, but she loves the poop emojis.
She loves the poop
Canadian,
emoji.
Yeah. So, I think that's important for patients to know also. And patients are not always compliant. So even if a doctor says, here, go see this nutritional therapist, it doesn't mean a patient will. So having the doctor really understand the value is obviously going to help them encourage this patient more so to go see a nutritional therapist that they're having to pay cash to go see. It's not covered by insurance. So I think the buy-in from the physician and having a really good understanding of what you do is really key.
Yep.
And be ready to be told no. What else do you think I may have told them about how to get your foot in the door with a doctor's office?
I have no idea.
How easy is it for someone to get a meeting with you?
It's impossible.
So that's what
I'm
I
a
said.
ghost.
Yep. Like, as far as anyone who calls this office is concerned, Dr. Martin is literally never here.
I don't even know if I exist.
Right. He has no email. He doesn't have a cell phone. He's not here.
Who is that guy?
And I told them, I'm like, look, I've been running a medical practice for 12 years. The first step is to get
the office manager.
Right. Like, so that means you have to get through my front desk person, which is also a challenge.
That's hard too.
I train that person to be like a rabid dog gatekeeper.
Coffee, like humor, jokes. Something.
Education, like come in and become friendly with that front desk. And like, then you'll get to me. And if you sell me, then you'll maybe get to him. So the expectation.
It's pretty anticlimactic though. When you get there, you're like, oh my God, I'm finally meeting Dr. Martin, the most amazing.
Right.
And you're like, oh, he's just a normal dude.
It took me so much to get here. Like, this is
really
the person
that
that's been hidden away. But that should be something that we're good at as nutritional therapists, is building relationships with people and, building relationships with everyone along the way. Like,
yeah, you can apply that to pretty much any field.
Don't think you can call an office and just be like, can I schedule an appointment with a doctor? Because the answer is going to be no.
No.
For a while before it is yes.
Yeah, time in healthcare is just so limited, especially for busy clinicians. And you don't want to be part of a practice or be associated with a practice that's not busy, unless it's a startup practice, which is a great opportunity. But, other than that, you just got to lay the groundwork.
Yeah. One of the other really interesting questions that was asked at, I think, the second group was someone asking about whether or not they should become an employee of a physician and or use space. So this woman was approached by a chiropractic group who offered her a 50-50 split, and she thought that was egregious. And I'm like, I think that's actually pretty good.
Yeah, standard operating overhead, 50%. So if you imagine every dollar you spend, if you owned your own business, 50% overhead in healthcare is actually pretty good. So if someone's offering you that, that's actually very, very reasonable.
Yeah.
So, I think it's better in most cases to be an independent contractor than to be an employed employed in a practice setting, but the employment portion, if you join a bigger practice, allows you to gain access to benefits and all the stuff that's that you may get from being an employee, retirement, all that stuff, healthcare. But in most cases, for people that are like all of us in the health field that's a single practitioner, it's almost better to be an independent contractor because of the tax benefits, and it allows you flexibility so you can do what you need to do.
Yeah, flexibility. And one of the things I said to her, like, if you really feel like this is egregious or not a great situation, like, do some of the math on your own end, but then remind them that you're not using a lot of disposables, so really all you're utilizing.
Well, I mean, people always overvalue their worth.
They do.
That's number one. No matter what we're in, I can't believe this. I'm so amazing. No, not really, because this is an open marketplace and there's many options out there. And I don't mean that to dissuade anyone. You just have to go in with a realistic viewpoint. That's first. Secondly, tell me what other environment you're going to get exposed to 3,000 patients. On average, a doctor that's busy has 3,000 active patients. Okay.
Well, this is a massive chiropractic.
Okay. Well, it's more, 10,000.
Yeah.
So tell me how you're going to get firsthand exposure to that. You never. It's never going to happen. You could pay, multiples of what you pay a year and never get that exposure for, what you're splitting with that clinician in that office. So people have a really hard time, and especially in the healthcare field where most of us went into this to help people. And we found out secondarily that you have to be a business person too. I know that we dealt with that first time when we were starting out our practice. It's very difficult, and I feel for that because I became a plastic surgeon because I just was creative and I wanted to find a creative way to help people. And plastic surgery fit the bill big time. And then I had to learn business, and then I had to realize the realities of business. But there's power in numbers, first. Secondly, working in a pre-existing functional business that has, a lot of positives and has growth potential is way better, no matter what that split is, than starting on your own. Starting on your own is very difficult. You get isolated. You don't have the connectivity. We know a lot about digital marketing. It's very difficult to get your name out there. So, and this is true, by the way, for any kind of business. When you're talking about one-off businesses that are sole practitioners or sole business operators, that are kind of siloed and don't have a lot of associations, very difficult to get off the ground to get to that threshold where you're really humming and the business is making a lot of money. So it's always better to have that association. I would highly recommend in anything in healthcare, if you're a sole practitioner doing something that would be associated with the medical practice, do it as an independent contractor, to be honest with you. It gives you the flexibility and you can go from there.
Yeah, and or doing space rent was actually something that brought up to her as well.
Space rent's great. You can look at that. That's an easy number. You can calculate space rent based on the floor plan and you just turn it back from there and then include services like answering the phone and stuff like that. So space rent's a good option.
Yeah. So there were options, and it was an interesting question as well. That one other woman that brought up a really interesting question, that this was actually kind of funny because she thought that integrating your practice meant like integrating your current medical practice into your nutrition practice, because she is a medical provider. So she's a mental health counselor. So she thought we were going to be talking about how to integrate your nutrition practice into your existing medical practice. I'm like, well, great, like bring it on, like ask me your question, And so that was still her question, like how can she integrate her nutrition into her mental health counseling? Because she obviously, as a mental health care practitioner, sees the value in nutrition and in its helping with people's mental status and your gut health, all of which have a direct impact on your mental status. So I opened it up to like the group first. I'm like, well, does anybody have any feedback on this? It was great. People gave her wonderful suggestions to host cooking classes and, kumbaya with people. Great advice, right?
Reiki too.
Right?
Yeah.
So this was the one time where I kind of, I let them all talk, and they did give her some good advice.
You let the flame go up and then you just put water on.
Right. She took some notes, and, it was all well and good. And I'm like, all right, well, I got to rein this back in. So I said, that was all great. Like, thank you, everyone. However, like as a care provider, you still have to reach, which we've talked about before, your standards of care. I'm like, you have to do that before you integrate anything else. I'm like, so what you should do is build a flow. So you have a mental health patient that comes in to see you. Obviously, on your first visit, it's probably not the time when they may be extremely in duress or potentially suicidal to talk to them about their gut-brain axis. Like, are you taking care of your gut health? Maybe try some glutathione. Let's detox your liver. Obviously not the right time. So what I encouraged her to do was kind of build her own clinical milestones So when a patient has reached this clinical milestone, now is the time that maybe I could start bringing in some discussion about nutrition.
Workflows is where it's at.
It really is.
Yeah.
Yep. And really encouraging her to do that work.
So someone comes into our office and we do plastic surgery and they wanted some surgery. The first thing I'm not going to talk to them is the nutritional therapy services that Amy offers. I'm going to see if they're a candidate for that. I'm going to set a plan and then I'm going to say, on top of this is what I think you should seriously consider through this process.
Right.
Yeah.
And especially for her patient population that is sometimes in crisis. Obviously, she needs to make sure she's reaching her clinical milestones before she brings in anything related to nutrition. As great as she knows it would be for this patient, you have to make sure you're reaching your ethical standards of care first and then integrate. So
good advice.
It was really fun. It was a fun question. So it was such a fun experience, though, being able to speak as, an expert in this particular subject, which I really was. And it was something that I reminded all of them was we have a knowledge base that not everyone has. Not every physicians don't have this either.
The physicians do not. The patients absolutely don't.
Yeah.
And so you are bringing so much value to the table in this field to improve people's health, to emphasize longevity, to emphasize recovery. You can transform people's lives just by simple tips and by doing your evaluation. So I think it's a huge value add.
Yeah. The other thing I encourage them to remind doctors of is that this is, we're not just trying to get patients to come see us every day for the rest of their life. My goal, honestly, working with any client is probably to see them 3 to 4 times and then hopefully not need to see them again, for an extended period of time, unless someone is, dealing with something extremely chronic and really challenging. I want people to get better really quickly. So I'm not going to try and bleed your patients dry. I want them to come see me, get tools that they can use, that they can integrate into their life and move on and continue to be healthy. And then maybe see me for follow-ups as needed. Not forever. And so that, again, just reinforcing that you want a positive outcome for this person. You want them to get better quickly. This is not some type of money grab for me. I mean, obviously, yes, I want patients or clients, but I also want them to be recovered or be better, be happy and be healthy. So that was really key too. But I encouraged everyone there, given that not everyone has the knowledge we have. And that was something that I guess, and I said this, I'm this is sometimes hard for me to remember that not everyone knows what I know. Because I just kind of get this assumption, if I know this, everyone
I don't
knows
ever
this.
do that. I don't ever go in a patient's room and start throwing out medical words. I had a patient tell me the other day, she's like, can you translate what you just said? Because I have no idea what you just said.
Right?
And I was because Amy's not in here right now.
But, I think we all kind of get in that space where, there is no unique information, right? There's nothing new.
Which is the problem with nutrition. Nutrition is a terrible topic to discuss with anyone. It has an immense amount of bias. And then also, if you combine that with medical issues, so they're already stressed out to begin with. So then, their brain is not maybe functioning at high capacity because they're having medical illness or they're having surgery and they're having a pain. And that you have to accommodate that. So, but I mean, again, I just want to go back to it. Nutrition is the one thing we can do as human beings to better our lives. It's at our disposal. It's right there. And it, in most cases, won't cost drastically more to improve your nutrition. I mean, a little bit more for sure, but not drastically.
It actually might save you money.
Well, maybe, but there is, this is where it gets into the weeds in terms of the food deserts and, where people live and stuff like that.
Food deserts are real.
Yeah, for real.
But if you can increase the nutrient density of your diet, you might spend less money on food because you're not eating tons of empty calories.
Yep. There's so many things when you say that. This brings me back. Oh, I'm just, I get satiate, I'm hungry at night. Well, just grab some peanut butter, has good fats in it. Eat that. That'll be great, before bedtime. That kind of fills you up, gets some good calories, and then you put some fats in and help you through sleep.
Sleep better.
That's a little tip.
Yes.
Right? And I know that you guys do a lot more than tips, but as a real person, as a patient, those are the things that are, really helpful and life-changing.
Well, I mean, it really is all.
So if by the way, Amy tip number 12,455. If you're hungry at nighttime and you shouldn't eat a big meal, and it's before bed and you have trouble sleeping, eat peanut butter.
Mm-hmm. Nut butters are great at night.
Not with sugar, no added sugar, just peanut butter, like peanuts or nut butter, whatever, with a little bit of salt's fine, but that's it.
Yeah.
Avocado.
Help you sleep better. Mm-hmm. Yeah. So that was really, like I said, it was really fun. And I was really kind of honored to be asked to do this. And I think there is a huge value add there because ultimately, I mean, most people who come to see you with any type of medical condition or chronic condition are seeing a doctor. So you should have a toolkit for being able to effectively communicate your value to a physician, how you're going to help their patient, how you can save them time, improve their outcomes. And those things are really important. So,
Yeah.
do you have any questions for me?
I don't know how you've survived 12 years.
What is it like working with a physician?
It's not that great.
No, the really crazy thing to think about.
What was the one patient called me the most loving narcissist she'd ever met, or it was something.
That was nice.
No, it was it was actually a compliment, but it was very funny how she said it.
Yeah,
it's not easy for high functioning people that are very stressed. Those environments, and that could be a chiropractor or a surgeon or whoever. Those environments can be a little bit difficult. The healthcare field in general is under a lot of stress right now with the aging population. The healthcare dollar doesn't go as far as it used to. People are having to pay a lot more of their co-pays. It's kind of a mess. And so you're coming in wanting to charge people cash for a service. So that's why you really have to bring it to the table. You have to associate with practices that are like-minded, like ours or like mine. And by the way, that didn't come naturally. That came over time with working with Amy. You have to build trust and then, maybe slowly lay it out. Mm-hmm. Don't get to the Reiki and the hands around the body thing right away.
If you work in energy healing, maybe reach out to like day spas.
Yeah, exactly.
Not doctors.
No, and that's also, everyone has interests. Like your interest may be more closely associated with a plastic surgery practice, maybe more closely associated with a nephrologist or kidney failure practice.
Or an OBGYN.
Yeah.
I'm super passionate about pre-gestation health.
Yeah.
Yeah.
So
there are a lot of niches to kind of
just kind of figure out what you want to do.
Yeah. So again, thank you everyone for listening to this podcast. I know it was a little bit off of our normal. We will be getting back to talking about the nitty-gritty of surgery in no time and all things plastic surgery related. We love that you guys are listening. We would love some ratings and reviews. Really helpful if you can follow us.
Our podcast keeps growing. It's getting bigger and bigger.
It is. We're getting big. I
don't know what to do with ourselves.
Right. But you can follow us
We're going to have podcasts about podcasts. I don't know. It's just getting so big.
Right.
But we do love the interactions. And the best part of this podcast, it's educational, is that we feel like we can help people. So anything related to that empowerment, it doesn't have to be about plastic surgery, about nutritional therapy, whatever you got, send it to us and we'll incorporate it into future episodes.
Health and wellness. Yeah. So follow us on Instagram at Beauty and the Surgeon Podcast. We're also at Jason Martin on D on Instagram and YouTube. So you can watch a video of us staring at this cool picture of our Beauty and the Surgeon cup at the conference. We would love some feedback. We love questions. We were chatting with Nils that we might do an Ask Us Anything episode soon. So if you have questions for Ask Us Anything, and I do read 5-star reviews from time to time too. So if you want a shout out on the podcast, leave us a 5-star, right? 5-star reviews. And if it's a 4-star, we definitely understand the criticism.
Yeah. To be honest with you, we like critical reviews too. Any kind of review works. Lastly, Amy's available for any roundtable discussion on pretty much any topic related to working with difficult physicians.
All right. Thank you so much, everyone.
Thank you.